everybody. My name is Nicole Perry, and I am one of the REACH board members, and I am joined this morning by Dr. Bender. Dr. Bender is a child and adolescent psychologist in private practice and on facility at Massachusetts General Hospital in Boston, Massachusetts. She is an assistant professor in psychiatry at Harvard Medical School. She is a psychotherapist and a psychopharmacologist, an award-winning teacher of psychotherapy, and the co-director of the pediatric GI psychiatry at Massachusetts General Hospital. She also has a blog that's called Let's Talk. And Dr. Bender, if you'd like to tell us a little bit more about your blog and where we can find it.
Thank you so much, Nicole. I'm really so pleased and privileged to be here today. I am I've worked as a psychiatrist at Mass General Hospital for 25 years as the embedded psychiatrist for pediatric GI, and, feel ready to tell you some of the things I've thought about with chronically ill children or children with specific disorders. My blog is Let's Talk. It's through Psychology Today. If you Google my name, you'll find it easily. And there isn't stuff that will be directly relevant to this talk today, but after this talk, I plan and hope the next one will be about sort of how to support the psychological health of the family with a chronically ill child. And so I think that's where I have about 20 minutes of things to say, and then hope to open the discussion with Nicole and we'll talk together. And so I think the first thing to say is how sort of inspired I've been over the years watching parents advocate for their child with a chronic illness that requires ongoing care, and the grit and the determination and the compassion that they have. And also that this is, while true, a hallmark view of what people go through. And that I want to talk about a more nuanced view of how hard it is to have a child with ongoing medical needs. And that in fact, to think about it as like a medical trauma. And so what is trauma sort of in psychiatric or psychological terms? It's this idea that you see a threat to a loved one or yourself. And so kind of the classic Hirschsprungs story, right, is that you give birth to a baby and you don't know this is coming, and all of a sudden there's a little bit of chaos, and that's so frightening, and you don't know what this is. And this is in no baby book. And you don't know anybody who has a child with this disorder, right? And then all of a sudden they're talking about surgery, or they're talking about you need to have like ongoing special care that you've never heard of for the first 3 months of your child's life. And then there's surgery for your baby, an ongoing threat of infection that is terrifying, and that this is a big deal.
Huge.
Yes. Yeah. And so when we look at the DSM is the Diagnostic Manual for Psychiatric Conditions. We look at post-traumatic stress disorder. It's sort of unlikely it's going to fit full criteria, but there's some overlap. And so, what do we see? We see that when someone faces a threat to someone they love, and in this case, it would be your child, you can get flashbacks, you can get nightmares, you can get recurrent memories of really hard times. You can feel anger, you can feel shame, you can feel guilt, you can feel fear. And we're going to talk about shame and guilt a couple times. They make a couple appearances in my little talk here. And the first way to understand the shame and guilt here, which would be like, oh gosh, I could have done this better, or I should have done the woulda, coulda, shouldas, that these have some psychological meaning, because it can be easier to blame oneself and say, I should have done something different, than recognize what it was like to hang out in space in this uncertain world, to feel like you're totally floating. And that's actually scarier, right? Than to say, oh, well, I could have done this, right? Then, which is, and it's actually more accurate often to say, like, I was stuck in the state of perpetual uncertainty for a certain amount of time, and it was awful. And that you can also get hypervigilant, so that you can, your child says that their belly hurts and you go cold. You know, all of a sudden you feel chilly. All of a sudden you have to go to the bathroom. Like, it's like a hyper response, right? You feel so scared, right? And then also you can go to the hospital, visit someone and hear a beep, and that you startle really easily. And so that these are symptoms of a trauma response. And so sort of looking, here's the Hallmark version and here's the real version. And they're actually both true. Hallmark is true too, right? But they're together. And how we need to see that they're existing at the same time to be able to help take care of the family.
100%.
Oh, good.
I feel so much like everything you're saying, 100%. The guilt, everything. The guilt is big.
Yeah. Yeah. And I'm hoping we can talk about that more. I have sort of, you know, as I want to tell you sort of my thoughts in general, and then I really would want to hear your thoughts in specific and in the questions.
And before we get started too much, I just want to let everybody know, as you're listening and the dialogue back and forth, please, there's a Q&A box at the bottom of the Zoom. Please feel free to go ahead and start asking your questions as you're thinking of them as Dr. Bender's speaking, and we will get to those once she's done with the first part of the presentation.
That's perfect. Great. So then I'm thinking there is a piece of Western culture that makes this worse. And what is that piece? That piece is this individualistic approach to the world, right? Pull yourself up by your bootstraps. If you do not conquer this, it is a personal failure. It is your duty as a parent that you are the person all the time, only you, that you take this on, that this is your burden to hold, that this is your burden to carry alone. Like maybe you and your partner, but just like that this is not a collective, right? And sort of recognizing it may be that you haven't even noticed this, but it's so embedded in our culture, but you're sort of like, okay, backpack on, I'm going to do this, versus thinking, wait, I deserve help. And that it was never meant, parenting was never meant to be just parents. It was always meant to be a village. It was meant to be a collective group. And because people are often far from their families now, we have to build our own village if we don't have extended family nearby. But then sometimes it can feel like building the village is like, am I supposed to need a village? What's wrong with me that I need a village? And so one piece, the next point I want to make, it is normal to want a village. It is better for your child to have a village. It is better to work on building it. And so that if you can include, I know that parents sort of tuning in have spent hours and hours thinking about how to take care of their child and all of their child's needs. And now I'm saying, can we expand this to include the family's needs? And that you also get help for the family's needs, which includes the parents. And that often gets dismissed, like, oh, no, like, I'm fine. How can I help my child? And I'm saying, well, it actually helps your child to include you in this bubble. So Go ahead, Nicole.
No, keep going. I'm fascinated. Everything you're saying, I'm like, it's just triggering some kind of memory or some kind of, this is just very helpful. I think this is going to be so helpful the next 20, 30 minutes.
I'm so glad. So I have 3 ideas then of like, okay, so you've laid it out. Like we've got the grit and the compassion. We've got the medical trauma. We've got the Western culture making it harder. Like, what do you do? Right. So I have 3 ideas and then we'll do questions. Point 1 is how to build your village. Does it always have to be you? Right? This feeling of like, I need to be there. I need to be there for anything my child needs. Right? And that there's 2 ways to do it. Right? There can be finding help and support in extended family and friends, in sort of thinking about how you can find a community of parents who also have children with sort of medical needs. It can be through your church, synagogue, or mosque. It can be through a group of friends, or it also can be hired, right? If there is a nursing school near you, you can bet that those nursing students need some extra money, and they would be great to be babysitters, right? Or to help out, and that they would be familiar and not overwhelmed with whatever you would teach them. And then I'm not saying that you would pass off care without great thought, that, you know, trust is earned, not given, and you would want to vet these people. But you would either, you know, have them come over, and if it's a group of mutual support, you feed them. And if it's someone that you are hiring, you pay them, and you have them shadow you. You pay, you know,
Yeah.
and so you don't just sort of say here, you know, I know people will say, well, I can't just leave my child with any old person. I would say 100%, totally agree. You'd have them shadow you. Then you would have them come for something quick where you like go out and get coffee or go to the market, come back, see how it went. And then you'd see if it works. And if it doesn't work, you would pass off, you know, pass and find someone else. But this idea of what does this provide? It provides the beginning of a village for you. And it's also good for your child, because children do well with redundancy, meaning lots of people where they can feel safe with, right? So that they don't feel like I'm only safe with mom and dad. Like, it is useful for them to feel less precious in a way, that other people can be helpful to me, and that they're, you know, mom and dad make sure that they're okay and that I'm safe with them. But then to have this extra support is really good for everybody, because it will support the parent, which then only supports the kid, right? And so moving to that part, which is now, let's say you are able to find some people that you feel comfortable with, how you let yourself take advantage of them, right?
Right.
Because they're
Right. That's where the guilt's going to start, is you're going to walk out that door and immediately you're going to go, what if this happens? What if they need this? Can this? Yeah.
right, right. No, 100%. And so that's where it's so important you feel comfortable, right, with this person. And we've got cell phones. You can have your ringer on. But that the other point is what good this does for you and your child, right? Because you leave to go out to dinner with your partner or a friend, and you come back rejuvenated. You come back more patient. You come back where your fuel tank is filled. And so there can be a feeling when you are a parent of a child with a medical need that you don't have a fuel tank. You need to just ignore your needs. And the problem is you continue to be human, so it doesn't work, right? And so you either take care of yourself, or if you don't take care of yourself, it will come out. It will come out with impatience. It will come out with irritability. It could come out with anxiety by you, your own
Yeah.
anxiety. It could come out with depression. So that taking care of yourself is not, if you can't do it for yourself, to do it for your child, because you will be better. You will be better as a parent if you are more fulfilled. And another way of thinking about this is you would never identify your child as only a child with Hirschsprungs, right? You'd be like, my child's into this, and this is how they interact with their friends, and this is their favorite food, and this is their favorite movie, and they like to go here on vacation, and this is what they do with their grandparent, right? You would never identify them only in a simplistic way that you are, this is my child and they have Hirschsprungs.
Right.
Right? So shouldn't you do the same thing for yourself as a parent?
100%.
Right? But might parents say, I'm a parent of a child with Hirschsprungs, and that becomes like one of the main identifiers, right? And they sort of lose, like, I'm a parent who loves to go out to eat, or I'm a parent who loves to read this type of book, or I'm a parent, and all those needs sort of go to the wayside, because you don't feel like your needs are important, right? And I would say that it's important to identify yourself as someone to take care of, not only as a caretaker. And that's so good for your child. And then parents might be like, look, it's like totally urgent. They're in the hospital. Like, what are you talking about? Of course I can't take care of myself now. And I would say, totally get it. You need to be there. And could you DoorDash a really nice Thai meal for yourself to the hospital? Right?
Yeah, you don't need to eat the hospital food. It's okay if you want to DoorDash them in and out, because that sounds really good in a stressful situation.
Right. No, and how important that is, right? So that you attend to you, and that attending to you it trickles down. It is only good for your child. It is only good for them to have a parent who feels like their needs matter. And it's also modeling, but it's just sort of recognizing it will
Yeah,
make you better. It will make you better.
absolutely.
Okay, then here's my third and last point. So in medicine, we talk more thoughtfully sort of recently, because we used to sort of say a patient, like here's a diabetic patient. And now we say, here's a person with diabetes. And we used, there is a history of saying, here is a patient, here's an alcoholic. And we say, no, 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 now this is a person with an alcohol use disorder. And so now we're thinking we have a child with Hirschsprungs, right? But in psychology circles, we do something a little even differently. We externalize the problem. So we might say to a child with profound anxiety, your anxiety is really bossing you around today. Or a child with obsessive compulsive disorder, OCD, might say like, the kid might say my OCD, which we have them name. My OCD named Quinn is really loud today and he's bugging me. And so what if in the privacy of a home, and this may work for some families and not others, we externalized Hirschsprungs? And what could that do to help the family, right? Because there can be a way that the family needs to feel very stoic. Like nobody wants to complain because they don't want the person who has the medical condition to feel guilty, right? Or upset, right?
Right.
And then I also think then the child can sort of feel stoic too. Like they don't want to complain and they see that their parents are worried. But if we externalize it, can the child now say, my Hirschsprungs is bossing me around this week and I hate it, right? Can the siblings say, I'm really mad at Hirschsprungs because I had to cancel my play date because of something that happened?
Right.
Can the parent say to a friend or to a partner, the Hirschsprungs is exhausting me? Because now we have words to talk about it. Because one thing is having a hard thing, having the ongoing medical illness. It is amplified and worsened if people don't feel that they can talk about it and ask for support and recognize all the inevitable human feelings that come along with it, all of which are complicated.
Right.
And so like to play with this potentially within the family, see if it can work, and that you could all shake your fist at the universe together and say that Hirschsprungs is really bothering us right now. So that everybody can be together in how hard it is, versus all being in their own lane, trying to make it through.
Right. Working
So,
together. Yeah, that actually similar situation just happened last week for the twins. So Benjamin's a twin his twin does not have Hirschsprungs. And we were at an amusement park. Well, amusement parks generally exacerbate his Hirschsprungs. And he came up to me and he's like, Mom, I know it's my birthday, but I'm kind of having a Hirschsprungs morning. That's how we it's either going to be a good Hirschsprungs day, a Hirschsprungs morning. And we kind of just know we're going to have some kind of delay in our day. And he's like, I feel really bad because we're here and you and Dad paid for this trip. And, my brother wants to ride all these rides, but I have to be in the bathroom. And we're like, cool, no big deal. So I stayed behind with him. We had 3 or 4 bathroom stops, but then the day resumed and he's like, we find ways to say, okay, what caused this? What are you eating? If you eat too much of this, watch that. And we all can work together. And then he can tell his brother, hey, I'm sorry. He's like, sorry that I couldn't go on this ride with you, my Hirschsprungs. And his brother's like, no big deal. We could do it again. You know what I mean? We just kind of make it so that everybody's in communication about where his day is at. So we can all adjust our expectations for the day.
right,
And it doesn't make him feel so guilty, right? Because Benjamin's a worrier in general. He worries about everybody else's feelings. And I'm like, cool, if you didn't get to ride that ride or I didn't get to ride that ride because you were in the bathroom, no big deal. It's going to still be there in an hour. It's still going to be there later or in a year. So I think taking that guilt off of them too, like you said, it's a lot for them as children to feel this huge weight.
Right. And it's an interesting question. So I'm, just wondering about small changes in language. of what if he says my Hirschsprungs versus if he says the Hirschsprungs,
Right. That's
right?
a
So
great, yeah.
yeah, so if he's able to say the Hirschsprungs is really acting up this morning, then the two of you potentially could say, that stupid Hirschsprungs, it's really annoying when it acts up on your birthday at the amusement park. We're going to, we'll work together on it, but I understand why you're frustrated. Like that makes sense. And so it's sort of putting it aside. Now you can both look at it and talk about it in a way that hopefully can open up the discussion.
Right. 100%. What else? There's a couple things that you said that you brought up, and I was just like, oh, this triggered. I have a few notes. The PTSD thing. So you mentioned that even a sound of like a monitor in a hospital. I will tell you briefly before we got on with everybody. I told you a little bit about Benjamin, but Benjamin's doing rather well since COVID. COVID kind of gave us some time to really focus on his Hirschsprungs. I have a very hard time even going to doctor's appointments with him anymore. Like it is, and I did it. I was at every surgery, every doctor's appointment. I'm the one that would fly to Boston with him. But I tell my husband now, I'm like, I need you to do the med doctor appointment or the med check. I just can't even be in there. It's just everything. And I'm so grateful for everything that I had, but literally a sound or hearing, if we're in an ER, hearing a parent say a certain keyword or something, I'm just like immediately brought back to that. And I guess because I'm so far past some of the constant hospital visits, because Benjamin was a frequent flyer, I find it really hard. You said that, and it just really resonated with me. And I can't imagine how many other parents have fear, even in current situations, going, oh my gosh, I'm going to have to walk back into a surgical room or into a hospital or into a this or it's prolific how much it can consume you that you don't even realize it while you're in it. But now that I'm out of it more so, oh, I cannot stand going to the doctors. I can resonate with that. But then I feel guilty for saying that, right? Like I feel guilty for saying I don't want to go to my kid's doctor's appointment, but I know why I don't want to go.
Right. And I'm 100% sure you're not alone and how normal and human it is. I think what's so good about bringing that up, right, is kind of recognizing that even as things are going well, that this is a psychological hit on everybody. And so then thinking that there can be, it's without thought that people are like, we need to get this medical thing, we need to get this medical follow-up, we need, but the psychological care can be pushed aside often also during crises because you just have to barrel through.
Right.
And so then thinking now with things calmer, like the need to recognize what this has understandably done, right? And how to care for yourself. And so thinking about what are the ways people can care for themselves, right? And sort of decreasing the temperature and making that part. So, meditation on Headspace and Calm, or there are also YouTube places where you can get it for free. If you kind of feel like if you have to go to a medical appointment, you can feel yourself going up, like that you could do a meditation for like 15 minutes, like the week beforehand would help.
Yep.
I think yoga, there's Yoga by Adriene on YouTube is free, or Down Dog Yoga is one that I started during COVID. I found it really helpful as I was there was a lot of mental health need. And so I continued that and, do 15 minutes a day, and it really helps my back. And that's really good.
I'm just getting into meditation. My therapist currently, she said, I want you to start with 2 minutes because I'm like, I can't sit still. My brain doesn't shut off. So right now for the last week and a half, I'm working on 2-minute increments of just sitting in silence because I get heightened anxiety in definite certain situations. But another thing I started doing is my husband went to the first one without me. Now he goes with me. And then I just went to my first appointment by myself in probably the last year. And I was okay. Like I was okay, but I was able to acknowledge and accept that like, it's scary and hard for me to go into one because of the anxiety of the unknown, even though now these are regulars scheduled. Let's see.
No, but hold on. Those are such important points. I want to highlight a couple of things you said that are so important. One, how great you're in therapy, how great that you can put that out there as like a really normal thing. What a fabulous investment, right? So that takes care of you, but that also takes care of your family, right?
Yep.
There can be a place, and I just, as a psychopharmacologist, so as an MD, that in some cases people might find meds helpful, and that can be that, again, that taking care of the parent is so important. That's in no way a negative thing. We have really good, if the anxiety did not get better for whatever reason with different therapies or meditations or whatever, these are things we have that work. Sorry, I'm right by fire station. In case you could, I don't know if you can hear the fire stuff. And so like to take advantage. And then I love how you exposed yourself. That was so smart. Like first it was like beautifully done. You had your husband go, you went together, and then you went. And of course you're going to be scared. Western doctors, in a way, it's scary. Like we go and they tell us what's wrong. And that's terrible, right? You go in even to your physical and they're like thinking like, oh, what can I find that's going to be interesting to like look at, right? And so you go in with a child who's already got a medical thing. Of course, you're going to be like, bare knuckling it.
Yeah, anxious because you don't know what they're gonna say.
You don't know. Yeah, and how normal that is. Acupuncture is another one. That acupuncture is really good in terms of also teaching a person to get into a meditative state and can help with relaxation. And so finding that's another good thing parents can do. But just recognizing and taking care of yourself, and yoga can be a way to do meditation if it feels really hard to sit still, because you're moving and it's still meditative, but you're moving at the same time.
Right. Okay, let me go here. We have Dawn. Dawn, thank you for your comment. She said, I definitely agree that you aren't alone with hospitals and doctor appointments. The night before my son's pull through, I did not sleep at all and was so nauseous with anxiety. I'm 100% with you, and I with you. Like I totally get that. It's just so many sleepless nights. I actually don't, still to this day, that's part of the meditation process. Dawn, we're working on my sleep because I still have a hard time sleeping just from anxiety. We have an anonymous question here. What techniques can parents use to help their child cope with anxiety before surgeries, hospital visits, or medical interventions?
So often in a hospital, they're going to have like a play lady, where there's like a child life therapist who can, so that would be for a surgery or for a procedure. I would call and talk to the hospital about how you can meet with the play lady who will, not always a lady, but the play person, right? Who's going to help talk to the child. Often they might have dolls to talk about it. It's a really good question, also a big one, because it would be different based on the developmental place of each child. So there would be different from 4 to 6 or 6 to 9 or 9 to 12 or teenagers. I think before doctor's appointments, I think generally for the younger set, it's not that helpful. So I would say like up to 6, it's not that helpful to go over, you're going to be seeing the doctor, they're going to be doing this, you're going to be doing that, because they're so little. All they're going to hear is, we're seeing the doctor, and they're going to get really scared, and they're not going to have an infrastructure in their head to understand what's going to happen. And they're just going to sit in anxiety till you get there. So I think the kid always needs to know before they get in the car, if you're going to a doctor's appointment, depending on your child, you could tell them potentially that morning or the day before. But I think what you would say is, we are going to be meeting Dr. Blank. And then afterwards, what do you want to do to sweeten the deal? There's a, gift shop after. Should we go get something to eat or a little present? Or here is your budget. You can pick something out. Or do you want to play a little extra video, blah, 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 something that they make. And so just sort of say, so we're going to do it. And then if they start circling around, I would actually try to change the topic if this is a younger kid, because they're not, if they're like, I don't want to go to the doctor, I don't want to go to the doctor, I don't want to, you at that point want to say, for a younger kid, let's talk about, what are we going to do at that play date, or what movie are going to watch this morning, or this weekend? Like, do we want to go see Moana? Are you, if they're old enough, what about Wicked? What have you heard about Wicked? What are people talking about? Or, if you're a basketball fan, or if so you want to sort of talk, because they're not going to be able to use the conversation to get ready, which is different than adults. Adults will sort of think about it and can cognitively get ready. Kids, not always. as they get older, there may be a way to sort of say, okay, would you want to talk about what they're going to do or what they're going to not do? But then I still think in some ways you just want to barrel through, because it might be very quick and you can't also, and it might be complicated and you can't know. And in some ways, pain ahead then can add to the anxiety and the worry versus, what we know is we believe in our team. Nicole sees Dr. Goldstein, who I know well, right? So like Dr. Goldstein's going to have a plan. It's going to work. We're going to figure it out. And we'll learn about it. We'll talk. And then, we're going to go to the gift shop.
Totally.
So that's helpful, at least for the.
That's helpful. My little 2 cents on that. Benjamin, we like to relate things to other. He's really big into sports, so we'll let him know, like, hey, this athlete, when he broke his whatever, like he had to go talk to the doctor. They fixed him. Like now you see him back on the field. Like they're here to help you. Kind of just that encouragement that other people go through it too. So that's just my 2 cents. If they're a little older, you can kind of relate that to somebody that they idolize.
That's so good. So good.
Okay, we have a question from Nikki here. She says, can you recommend someone that does counseling or therapy for parents with PTSD in the area? We are in BC, but Zoom is great too. We are struggling to find somebody locally trained in the area. So I think, yeah. I know she's in Boston. So I think what we can do, Nikki, is I will have the board. We have our Canadian board version over there, and we will research and get back to you. I will have Natasha work on that for you, and we will get back to you with some helpful links or suggestions of where we can get you connected with somebody locally.
Yeah, but I think, and in a way, just sort of thinking, what are you looking for? You're looking for a compassionate person who is worked with families, who is going to create a space where you can talk about what's going on with you. A lot of times with therapists, you go and you meet them. It's so much as the match is important. You meet them, and if you feel cared for and understood, you meet them again. And if you feel judged or they're simplistic or they're not hearing you, you don't go back. And the problem with that is that it is tricky to meet multiple people because you're putting sort of your heart on a plate and saying, can you help me? But it is how you find someone who will be a good match for you. Because I think even more than sort of qualifications is the compassion and the ability of the person to listen. And so there may be some who do lots of research on this, or, this is what they do, but you go in and you don't click with them, and clicking is more important than almost anything else.
I can agree 100%. Okay, another anonymous question. What are some strategies or tools to help build a confidence when managing HD? We struggle with our little one feeling embarrassed.
So this was a little bit from my prior HD talk, which you can also see. We go into this more, which what we had sort of talked about was how, like, learning the specifics of where the kid is embarrassed. And in the prior talk, one of the things that came up is like, what if you're at the table with your friends and, you sort of have some gas and it smells and they're like, what is going on? And it's you. And we talked about sort of the idea of with the kid, if they feel really embarrassed, if you can help them and even role play at home to kind of lean in. I think especially if they're a boy, because they talk about poop or gas all the time.
It's a little easier to lean into that one.
Yeah. And to just be like, oh, sorry guys, had these things happen, and sometimes, even have a spray and say like, I'm just going to spray around and you can borrow this next time you pass gas or something. And, there can be a way where it gets bigger if there's a feeling it's so bad, oh my gosh, you passed gas, or you might have a little accident, you have to change clothes, and that the kid just freezes. And if it instead can be, let's just kind of go, everybody's got something. Everybody has something.
Something.
Yeah. And if we can just sort of give you some ideas to manage it. And what's really notable is kids will ignore what's going on with other kids, unless there is another reason that for some reason um, that child's a little vulnerable. And so that, I've had kids with encopresis who poop in their pants. I've had loads and loads of patients with that. And that's often they'll be like, everyone will ignore together that all of a sudden at the table, it will smell like feces. If they like that child, everyone will just ignore it. And so to sort of note that and note with the child when things happened and how it went fine and it wasn't a big deal, because more likely than not, they get through it and then they just get really anxious about what's going to happen or how it, what will be the reactions. But if you look, often the reactions are unexpectedly neutral.
Yeah, no, usually, yeah, I agree that they are. Um, for this parent, I'm not sure how small they are, but with my personal experience, we would take Benjamin like first day of preschool, first day of kindergarten. I would go in with him. We would tell the class like, hey, Benjamin has this. Do you guys have questions? He farts a lot. He smells funny. Sometimes it's super loud. Sometimes you don't hear it, but it smells real, real bad. We'd have like a whole dialogue. We'd let them ask questions. And I think me being there to support Benjamin, like while they asked questions, made him feel confident. But then he also got to say the cool parts about it. I get to fly to Boston, and one time Santa flew in a helicopter and came and saw me at the hospital. So like it lets him be vulnerable, but also shows how cool his experience gets to be. That's different than other kids. And so that can maybe help. We did that till Benjamin, third grade was the last grade that I went and spoke to with him. Fourth and fifth grade, he did on his own with his class. So he got up in front of his class. And by this time, we had Eric and Isabel's book. My brother has Hirschsprungs. We would bring that into the classroom and donate it to the library then afterwards. But now he's in sixth grade. And so now he kind of just tells his buddies, hey, I have Hirschsprungs and yeah, I smell funny. So I keep spraying my bag or whatever. But yeah, as a little kid, I think helping them feel confident in their illness can help a ton too.
I think that is such a good example of how to lean in and just own it, right? And so because I think that a lot of times and the pain is kind of the secrecy, so there's the pain of having something that's different, but then there's the pain of the secrecy. I don't want anyone to know. I don't want it to be different. I don't want it. And then if it's just owned, right? And this really works across the board with all different illnesses, both medical and psychiatric, so the kids with ADHD who are like, I've got ADHD, I've got to go and take my test in, a quiet room now, bye, like that's easier than they're like, oh, I've got to go and be very quiet and secretly sneak out to take this test because it's something to be ashamed of. And so I think they will follow the parents' lead. Like Nicole, you modeled so beautifully. I just love that.
And here's the thing, he's in sixth grade now and he does it on his own. And I just feel like it takes away that embarrassment, right? The kids get to ask all the questions, right? Because kids in kindergarten, little kids, they're curious. They want to know all the things. But it normalizes it so much so that Benjamin is not as embarrassed because he's been owning it since he was literally 3 years old, talking about it. So I think that's something to be said starting so young too, encouraging them to just own it, because then at this age at 12, he just doesn't care. Even if somebody's like, oh, Benjamin farted really loud, he's like, cool, dude, everybody does it. Like that, he just kind of just like water off a duck's back at this point. So that is, again, my 2 cents.
I just think that is such beautiful modeling. I love it.
Oh, I appreciate that. Okay, our next question. How can parents ensure that siblings of a child with Hirschsprung's disease feel supported and not overlooked? Any tips? It can be hard to find a perfect balance. Oh, right. Yes, it can be.
Right. So I'd say a perfect balance is not available. Like I think that perfect is the enemy of good. And if there is it's not going to happen, but I think you watch the seesaw, right? And so if there's a seesaw of sort of like you're moving towards more time with your child with Hirschsprung's, you think, okay, my other child really needs some more attention. I'm going to try to move it back. and sort of give them extra attention. And I think what you'd want to do is potentially go on a walk or go out to coffee, or, child gets hot cocoa, and just and ask. You want to make these things, there's so much power in making things talk outable, like that you can talk about it, right? And so that families kind of get frozen and not wanting to talk about it because not wanting to cause harm or like look at the pain, but in fact looking at the pain is a way to decrease the pain. So you're with the sibling, you say, how's it going? How are you feeling? Because with each child, it can be very different, right? How are you doing? I know I've had to take some extra time with your brother, with the Hirschsprungs. The Hirschsprungs has been active. How are you feeling? What do you wish we could be attending to with you that we aren't? And then that doesn't mean you're absolutely going to be able to do it, but then you negotiate. You can say, okay, I really hear you. We can't do that, but could we do this?
Mm-hmm.
If there is a way to sort of create like 30 to 50 minutes with the sibling who doesn't have the Hirschsprungs alone, or, a walk once a week, or something special, just that you would be able to attend to them. We know the power of 50 minutes of one-on-one time because that's what psychotherapy is. And so you can, if you were to do that with, the child who doesn't have the Hirschsprungs, that you could then sort of be an ongoing conversation of how is it going, noticing, and I think giving them credit for when they are helping. And sort of, I noticed that was, you sort of sacrificed here and sacrificed there, and giving room for the child to say, and I felt bad, or I felt frustrated, or I felt resentful, like all the feelings. We are responsible for our actions, right? So like, it's important that siblings step up, or if they can't manage if they can't get exactly what they want because the child who's ill is the priority, that they have to wait. And we need to be, our feelings we have, and I think that those just come up and we don't choose them. And there is tremendous power for validating those feelings. I really appreciated that you had to put this aside, and I totally understand why you would feel resentful, and it was really frustrating. And what can we do looking forward to kind of make it up to you?
Yep. I agree. Validation, 100% validating. It's not going to change the outcome. Like, right, the whole two things can be true at one time. It's not going to change the outcome. You're still going to have to give your HD kiddo more attention at that time. But just even validating, like you said, giving them that, I hear you, I see you, your time will come. It's just not right at this moment, kind of.
Right.
That's
a beautiful way to put it, right?
Okay, our next anonymous question is, how can I help my daughter who had a traumatic experience with how her second grade teacher handled her issues? And so she does not want to she does not want to tell anyone, but also struggles with no one knowing. She seems to feel trapped a bit with it.
So, there's sort of two questions.
Twofold. I saw that as well. Twofold.
Yeah. I think with the second grade teacher, right? Like if the second grade teacher is not helpful, throughout childhood, whether or not someone has a medical illness, we're going to meet adults, that we don't click with, right? And so then I think in the home, how useful is it to say, like, Miss Smith is not really understanding. Miss Smith is not that thoughtful about this. And then let's think about how we want to manage this. I can go talk to Miss Smith. Do you want to be there or not? If Miss Smith is not responsive, should we go to the principal? Like, I think what you want the child to see is something can be done about something. We're not just going to ask you to sort of suffer if this teacher is not understanding and not tuning in. And then I think with the child, of her saying, like, I don't want anyone to know, but it's so hard for people to not know. I do wonder if there are, within the Hirschsprungs Foundations, are there support groups for kids, or could she be connected with another child, and the other child could say their experience. Like Benjamin, it seems like has a
Yeah, Benjamin has offered his email up on a podcast live, and I was just like, So yes, my son Benjamin would be more than happy to be email pen pals. But yeah, I agree with what you're saying. Getting somebody that can say I've walked this same path, and I can give you things that worked. And again, to like you said with the teachers,
right,
you
right,
can
and
always go to somebody above. You know what I'm saying? We
right.
have a 504 in place. A teacher last 3 weeks ago told Benjamin he took 5 minutes to go to the restroom, which in his 504, he has unlimited bathroom time. And she told him, "You have lost bathroom privileges for the remaining of the year." That's what her words were. He came home so devastated. And initially, I was very angry. And I was like, he has a 504. I'm going to go off. And what I did instead was I sent her the Reach uh, link, and I said, I would love you to visit our website for Reach Hirschsprungs, and I would like you to read Benjamin's story that's on there. And I tried to educate her, number one, but then number two, I did throw in there, remember, he is on a 504. You cannot do this. It's scary for kids with Hirschsprung. I mean, he was petrified. So teachers and adults too cannot understand this, and it can be very, very hard. But please use Reach as a resource and send them our link. And it describes what it is. It describes difficulties. It has people's personal stories on there that can help other people. So literally, I'll just write it down. The attendance lady one day wrote it down for her because she's like, you pull him out of school like twice this week. Please visit reachht.org and figure out here what he has. This is what we're going through. So that could be another resource for you as well, Anonymous.
No, I think that is fabulous. And sort of thinking about, okay, when they miss something like this. So first stop can be parents. And I love the Reach as a resource. And then next stop can be your doctor. And sort of as a psychiatrist, I'm writing notes for my patients with inflammatory bowel disease or different situations, or and sometimes calling the school. And, that I'm sure, Dr. Goldstein could write through Patient Gateway a quick note saying, this is why. If they're, the 504 should be enough, but that we're advocates also. The medical team is there for you.
And can help a lot. Dawn wrote, we did the same thing for school in September for HD Awareness Month. I sent a letter, she couldn't go herself, that his teacher read to the class along with his ostomy dino stuffy, his 2 full bravery bead necklaces he earned from his hospital, and the cool food menu he got to pick from when in the hospital. He also brought an unused ostomy bag to show everybody that how he uses it and why he has a scar. The kids are much more understanding and kind when they know. Agreed, Dawn. Amazing. Amazing. And I love that you have a dino stuffy. We have a bunny stuffy that is our surgery bunny. So I love seeing the connections of all the parents and the things that we do to help our kids cope.
Right. And I think, there you can feel the power in the webinar and in the Zoom of people sort of holding each other, right? It's now the power of the collective. I do want to note that there are less questions of the last 3 or 4 about how to take care of the parents, right? And
right.
that's so easily.
I heard you say that. So one of the things that triggered me at the beginning of your conversation about self-care and taking care of yourself, and again, please feel free to ask questions or chime in with your own personal stories. But for me, it was my husband had a really hard time initially with the diagnosis, right? I had already had a child, so I had been through parenting. These were his first children, twins at that, and now one with this super rare disease that is going into surgery. And my husband had a very hard time just emotionally handling it. Like he was present for the surgeries, right? But he couldn't mentally wrap his head around it. And he really struggled with it. So for a long time, I felt like I was the only one able to be responsible. And then, fast forward a little bit, I finally, like you said, I got to the point where I wasn't taking care of myself at all. I wasn't filling my cup. I wasn't anything. And I finally had to look at him and say, hey, I know this is super difficult for you, but like I need you to come in here and maybe take this burden off so I can do this. Again, he had no problem staying at the hospital, doing anything, actively being present. It was more the mental load that I was carrying that I needed to put some of that burden onto him. And I think sometimes even with partners or in, help, when you're a caregiver and you have family members that help, there's that just sense of you then releasing that burden to somebody else, which isn't a burden, but you feel that way because you feel like, oh, now this person's going to have to carry the weight of what I'm carrying. And I just think that there's something to be said in that self-care, and parents struggle even within their own marriage to say like, hey, I need you to take this mental burden off me for just a little bit because I'm not here right now. And it's okay. It's okay to not be okay. 100% it's okay to not be okay.
Well, it's also like just real, right? So that anyone who just says they're okay is lying, right? And so then when you think about, okay, since people, this is a struggle for all of us, there is so much power in just being real about it, right? Because if you don't talk about it in these authentic terms, it pops up other places, right? It's going to pop up of being like really angry that they didn't do the dishes, like super angry, like, get plates.
Explode, yeah, and you're so mad at the dishes, but really
right?
it was just everything else from the day that you're just like, oh.
Right. And so like that the intimacy is really increased and fortified by the honesty of the discussion. And that also when you pass it off to someone else to think, oh gosh, now the guilt that it's going to be on them for a little bit, it's not going to be nearly as hard for them to take a shift than it is for you to be taking, a grand majority of these shifts. Like they're going to feel meaning and purpose to help someone that they care deeply about. And then it is really about you learning to sort of then say, let go and say, okay, they are safe now. How relevant it is for me to take care of me because it will allow me to be more there for my family.
And that's hard. It's hard for a mom who's a caregiver and a mom. I had the hardest time for a really long time. I would not want to do anything for myself because then I was like, oh, I'm spending money that could go towards something medically, or even if it's not monetary, how do I have time to sit and read because there's laundry that needs to be done, dishes that need to be done, the other children need to be tended to. But to your credit, self-care, how am I supposed to be the best version of a parent or a mother if I'm not taking care of my simple needs? And to that, maybe you just adjust your day too, right? I get up at 4:30 every day because I love to listen to podcasts. I cannot listen to podcasts during my work day, my kid day, my all day. So from 5 in the morning till 7, while I'm slowly getting ready, I'm listening to podcasts. And people are like, you spend 2 hours getting ready? Yes, I do. I absolutely do. And you know what? That's my self-care time. I do my skincare. I listen to podcasts. So find any time in your day to just do something that's for you, even non-monetary. That's just, I like listening to murder podcasts. Like that's what I do. I find a great pleasure in listening to it and learning about something that has nothing to do with what I'm going through, right? Like hearing somebody else's just pain. Let's see, Maxwell just wrote in and said, my son is 9 now and has less episodes of EC or potential EC, but when he does have tummy pain, problems pooping, especially out of the blue, middle of the night in Tahoe in a snowstorm, I start panicking and my body shuts down to the point that I now have to lay down to not faint and then have to run to the bathroom. Is this a delayed trauma response? Suddenly I have no ability to look after my kid when this happens. Okay.
Yeah, no, I appreciate that question because that is a question sort of saying like this affects the parents. This is so real. That sounds so scary. So I would think, yes, no, that is like a classic trauma response. So let's think about what you could then prioritize for you, kind of recognizing that this is going to happen now and again, right? So that could there be a way that you integrate meditation, start putting that in your day, like 10 minutes a day, right? So that, because it's a skill, right? It is an absolute brain skill. We also know it decreases blood pressure. Like it was, there was this whole, a cardiologist wrote a whole book about the relaxation response because he noticed how helpful it was biologically. And so if you were to do that every day, the next time when this comes up, you would be able to try it. Or I would even say talking to your PCP or seeing a psychiatrist and getting a small, tiny dose of Ativan, so that if this were to happen, and if you feel like you cannot even think, depending how bad this would be, that would be okay. As long as you're not driving, right? Which, that you could take a tiny little dose of something if that allows you to kind of get through it. And if it is something where the anxiety is an ongoing strain, that you see somebody and sort of talk about the different therapies that are available. Because people will, if they break their leg, they immediately go and they say, of course, I'm going to see an orthopedist, I'm going to get a cast. But if you are suffering psychologically, people will just walk with it for years. And to really prioritize mental health is important as anything else. We have such good people.
I can't say that enough. I like my therapist. I told her the other day, you're my best friend. And I know I'm not yours, but you're mine because you get me through everything. Maxwell, thank you for your vulnerability in that. Because yes, the anxiety in this can be very crippling. Dawn, what if, let's see, sorry, it scrolled up. What if you don't have someone to share the burden with? Would therapy be a good place to start? My son's diagnosis and several surgeries took place in the heart of COVID shutdowns. I literally had to go to all the hospital appointments, admissions alone, as they would only allow one parent. Even now, with no lockdown, my hubby is at work from 5:30 to 5:30, an hour away. He is the main earner for our house, so he can't really come to help alleviate the mental burden. What would you recommend? Dawn, I love all of this. I love your vulnerability as well.
No, I really appreciate people writing in and saying how hard it is, and that it's sort of a gift to everybody else, right? Too, because everybody else, and it sort of feeds on itself. One person, Maxwell, you bring up your concern. I'm sure it's many, many other people have it. And so now also bringing up this next concern as well. I think therapy is great. I think therapy is a wonderful, wonderful investment. It works. It is, and I, having done this now, because I do therapy in my private practice, I do a little therapy at Mass General, but not really, since I limits how many people I can see. But I have people who've been in my practice because they've had really difficult things that they've gone through for several years. And so, they go on vacation and they come back and blah, blah, blah. I've had kids that I saw grow up, and then now they come in and check in with me when they're home from college. Like, it's like a primary care person for your mental health. And if you are the primary caretaker of your child who is medically complicated, I think it is a great investment. And also what's interesting is the one person in therapy, it's like putting a rock in the pond, and the positive responses filter to the children and to the partner and to the siblings. So it will help everybody.
Yep, I couldn't agree more. And then obviously reach out to the Hirschsprungs community. Reach has a Instagram page. I know you can find myself through that Instagram page, all of our other board members, a community of amazing people. I've met many of the people I'm friends with through the Hirschsprungs community. Alicia mentioned, I was going to mention how much meditation has helped us. We, my hubby, and our HD son try to meditate 2 times a day, and it has changed our entire world. Thanks for mentioning meditation.
Oh, that's wonderful. Maybe you can share where you get the meditation. If they can add, Alicia, because I just think that's terrific to sort of bring that up. I'm looking at the time because we're going to have to.
Yep, we're going to wrap soon, but everybody, please feel free. This will also be available on YouTube. We'll post it on YouTube afterwards, so that if you didn't get a chance to watch or you'd like to share it, you can find it there. Dr. Bender, thank you so much for your time and these very thoughtful discussions and question answers. And then again, you can find all of us through Reach. And I am just very thankful that we were able to have this discussion today. And for anybody else that needs our Instagram, it's reach_HD to find our Reach. And that's where we'll also post the link to this YouTube video.
Thank you
again so much, Dr. Bender.
Your points were so good. So thoughtful.
Thank you. I hope next time in Boston I get to meet you.
Yes, yes. You'll let me know when you're there. And I have this other webinar, I think it was a couple years ago. I was like so delighted to be asked back, which is about more from the child point of view in case people.
Yes, I will actually ask Natasha to post that into our, a link into that as well when we share this, just so somebody can listen to that one first or after they listen to this one.
Great. A pleasure.
Thank you guys. Everybody have a great day. Bye-bye.